I have a very brief presentation today because we're basically covering just some important points that I want everyone to take a look at. We can see our numbers from compared to last meeting, I'm sorry. We can see that the number of cases have gone down as well as have the deaths. This is the graphic that I've showed you since the beginning, but I wanted to use the CDC graph that has the 7-day running average so that we can see, particularly to the right. Let's see, and I get this little thing to go up here. This curve, as it was coming down, you know, we were concerned about this little blip, and then it started going up. But here it is coming down now, and I think you can see that more clear in the CDC because they're using the 7-day running. And this one is coming down also, but it's a little harder to see. So from now on, I'm going to use this graph so that it's more clear, if that's okay with everybody. Our next point is this that I want to discuss because this is very important that we take a look at this. As you know, I have been saying that it's the 15 to 44-year-olds where we had about a very large number of cases, but what we're seeing now is that it's creeping up and down. It's spreading the number of new cases. So you can see that the 5 to 14-year-old now has 10% of the new cases. This was not like that before. And so we're concerned about that. It is very fortunate that Pfizer in the next week or so is going to release the 12 to 16-year-olds. So in other words, the 12 to 15, because we can now vaccinate with Pfizer 16 and above. So this will give that age group the ability to get vaccinated. And it's very, the timing is very good because we're seeing these numbers creep up in that 5 to 14-year-olds. So that'll give some of those younger kids the ability to get vaccinated. They're continuing to work. They're going to continue doing other age groups. And I hope that by the end of this, we'll be able to vaccinate everybody in the community like we do with the regular flu vaccine. We're also, has spread somewhat down. So we can see the 45 to 54 also taking up 15. It's fluctuated between 15 and 16%. So if you take the entire box, that's 82% of the new cases are in that red box, from the 5 all the way to the 54-year-olds. That's very significant. So that's where our new cases are coming from. As you can see, in the 65 and over, we only have 9%. Last time we met, it was 8%. So that's staying very low. Therefore, these people are not going to the hospital, and they're not dying as many. I mean, we still have deaths, but not as many. And so that's keeping our cases, even though our cases are going up or fluctuating, that we're not seeing the deaths have continued to go down. So that's a good indicator. But we do have to attack. In other words, we have to go after this box in order to get those number of cases down, and most importantly in that age group, stop those long-term consequences that we know that those individuals we're now finding severe consequences, sometimes worse than their illness that might only be 3 or 4 days, and then they recuperate, but then they have long-term effects after that. So that's an important point to make in terms of my going forward with the presentation. The next slide is a summary of the vaccines. So what I did is I took our numbers out of our vaccine summary report, I put them up here, and then I put the total and utilized the data that we have of our population from the 2019 census, so we stay consistent with what we've been using from before, the 1,496,770 2019 census, and I subtracted the population that's not in play right now, which is the 0 to 15. That's about 256,546, and I suppose that there may be some discrepancy the way you calculate that, which database you use and so forth, but it's around that number. So the total population able to be vaccinated, instead of 1.4, it's 1,240,000 1,224. So taking the total people vaccinated either with first doses, which is this number, or the people that have completed the series, this number, or those who have either the first and or the series, the total number vaccinated, you can get the percentage of our population that is able to get vaccinated. So for completed series, 37.35% of our population have had their series completed. So under 50%. For total vaccinated, in other words, they've had at least the first dose or the series completed, it's 52% of our population. So as you can see, we're nowhere near any kind of herd immunity here, nor in the country. The number of vaccines have been going very fast. The vaccines are very well available now everywhere in the country, as well as for doctors' offices. We are helping some offices that have not gotten their full vaccination supply. We're supplementing them with vaccine that we have ordered, because we've ordered enough vaccine to be able to help all our local folks here. We're also going to the ports. We've helped out with the jails. We've helped out many places. We'll be making a full plan to go out and mobilize our mobile units to go to spots that are still underserved or that need to have help in order to get people vaccinated. And so that plan, we'll be working on that specifically on Thursday so that we cover the community as widely as possible and as efficiently as possible with a good plan that would cover everywhere that is needed. The whole idea here is that we want to get more people vaccinated. The number of vaccines in arms peaked at 3.5 million, above 3.5 million in one day when we added the new groups to our vaccinations. We're well over the goal that the president made of over 200 million, but we have to do more because it is not likely that we're going to reach herd immunity. In 2009, when we had the H1N1, we didn't reach herd immunity for 2 years. So it's not likely that we're going to reach that herd immunity at this point, even though we're vaccinated at a very fast clip. I hope I'm wrong, but that's what it's, the experts are saying, that it's not likely that we're going to reach herd immunity before this is over. So what is it that we're left? So for people who cannot get vaccinated, their only protection is the mask. So we're going to obviously continue to encourage people that can't get vaccinated to use their mask, because now when you're in public, you're not going to know who's out there vaccinated or who's not vaccinated. When you're indoors, we're still all at risk, and we know that the vaccine's only 95% efficient, so you still have the possibility of getting infected. So the other issue that I also wanted to say for the record is that our state is still at a very high virus spread. Okay, we're still in the high zone for the entire state of Florida. Our county is the only two counties that are at the top of the highest level is Miami and Dade, and for the southeast, we definitely have the most virus. We're right below Miami and Dade, so we are at the second level of the proportion per 100,000. We're at 10,558 per 100,000. That's high. If you take that into a percent, that's a 10.5%. So that's why I continue to say that our daily positivity and our total positivity have an effect. That's what's telling you how much virus is in the community. So please keep that in mind as you walk around, either outside or you're inside restaurants especially, or crowded events such as sports event. When you go out now, those who choose to go without the mask, keep that in mind. We're also want to make sure that anybody who wants to get vaccinated has the opportunity to do that. There is plenty of vaccine. We have open appointments. We're going to remain appointments at the Mid-County Center with the Health Department, and we will also be distributing vaccine to those who need it or who are having difficulty getting it through other sources. So please call us. We're here to help everybody, and most importantly, to put as many shots into people's arms as possible.